I'm Sophia.
I'm Ava. I'm 16 right now. She's 18.
We're friends.
Yeah, we're friends. When we're together, we goof off a lot and
listen to music.
Yeah.
Jam out.
Like most teenagers, we are very busy. We always have a lot, like sports and school.
I have dance twice a week, and I used to play volleyball.
Sure. We always had stuff to do in the day. It was like boom, boom, boom.
We're so busy, but with our Cochlear implants, we never miss out on anything. We can connect it to our phones and listen to music and do
we listen to
and call
music all the
people,
time.
especially. That helps a lot.
Yeah, we can do it all on our phones, on the smart apps.
After 40 years of healthcare financial management, I decided to retire for good, and my wife and I pretty much do what we want. On a day like this, I'll sit on the deck watching the dogs play or watching my granddaughter play and relax. But about 2008, my wife said, Ken, your hearing is getting bad. And so I ended up having my implant in my left ear. After the surgery took place, it was like a whole new world opened for me. I could actually hear better. I could hear the TV. I could hear people talking. It really improved the quality of my life. There's no question about that. It was one of the best decisions I made. Sandy was my audiologist I went to, and she was a very caring person.
I see patients as long as they need me, and for my cochlear implant patients, that is the rest of their life. Having that trust, knowing that I'm in their corner, is really important, especially when you have this device and you need this device to hear.
Our audiologist told us about this new thing, the remote check and the remote assist.
She told us that we could just all do it on our phone.
She said it was a way that we can connect with her without having to come in for an appointment.
We always have so much to do, so it's definitely easier.
Being able to have the remote care has been amazing. Everything with sports and dance and school.
They have the option now to do that instant feedback remotely. Sometimes you can't make it to those appointments, trying to coordinate all these schedules.
That sounds good, perfect.
It was easier than I thought it would be. I'm doing that from the comfort of my home in the environment that I'm going to be listening to the majority of the time. Make it a little bit softer, that would be great. I didn't have to drive 2 hours into an office, and we could do it and make sure everything was okay.
Good, thanks. Prior to remote care, there was very limited hours that we could see patients. We'd have to schedule an hour for any change we wanted to make, because you don't know what you might be running into. Now we can have those appointment times be shorter and more efficient for the clinic, but definitely more efficient for the patient. And we can do a 15-minute remote assist appointment in between whatever they have going on that day.
I would probably have a hard time finding another audiologist that I had the same bond with, if you will, to get to know each other, not just as a client and professional, but also on a personal level, which is really nice. Sandy is just a very honest, candid, straight shooter, and I just love her to death as a professional.
I love working with cochlear implant patients. It is absolutely my passion. I love seeing where this industry is going.
Having that remote care is just great. The girls have really grown up with Cochlear, and it has grown up along with them as well, with the technology changing and advancing the way that it has. We've had to get new cables quite often with two very active girls and trampolines and dancing and roughhousing with their siblings, and it comes very fast, and then they'll follow up, make sure we got everything okay. And then what I love was that they always send the packaging ready to return anything that we needed to return. It's already set and easy.
Definitely having cochlears is so much easier. With technology, it's gonna get more simple to use and
convenient.
And very convenient, yeah.
If we have technology and we have the ability to serve patients without being face-to-face with them and still give them the same quality of care, I think that is the shift that should occur. They finally made the decision for a cochlear implant, and they're on this journey to improving their quality of life and their interaction with their family and friends. We are obligated to sort of make it as easy on them as we can.
When you're working with any kind of healthcare professional, as a patient, you have to have the confidence in that individual that the person is looking after your best interests. I'm always open to new ideas and stuff, so my first thought, okay, let's give it a try, let's see how it works.
Cochlear has always been at the forefront of technology. They've continued to make things better for our patients, continued to make things smaller, more accessible. It hasn't brought me away from my patients, it's brought me closer to my patients.